Disclaimer. Before we get started, this episode is for informational and educational purposes only and is not a substitute for medical or professional advice. Please follow your organization policies and consult a healthcare professional. Now, let's get into today's topic. One morning, a child arrived at a preschool with a small cough. By lunchtime, two other children started coughing too. In early childhood program, illness can spread quickly if proper hygiene and health practices are not followed. Good morning and welcome back to the HG Realistic Show with Mr. Grimm. This show is dedicated to protecting, educating, and empowering families and early childhood professionals around preschool safety. In our last episode, we talked about controlling the door, secure entry, safe dismissal, and visitor safety. Today, we're stepping inside the community. We're talking about health, hygiene, and illness prevention. Because safety isn't only about security, it's about protecting children from preventable illness. This show exists because children deserve a safe community physically, emotionally, and medically. Healthy safety is not just about reacting when someone gets sick, it's about prevention, about consistency, and responsibility. Let's start with daily hygiene. In preschool setting, germs spread quickly. Strong hygiene practice including proper hand wash before meals, after bathroom use, after outdoors play. Now, sometimes when we return from outdoors play, some students may or may not wash their hands. They're going to the bathroom and they turn around within a second and they're out. They're not being questioned that they wash their hands or not. So to prevent that, all preschools or daycare should have sanitizer and wipes to clean their hands just in case. Teaching children how to wash their hands correctly. Routine cleaning and disinfecting of toys and surface. That should be done once a week. Safe dispensing and toileting procedure. Proper food handling practice. Hand washing is one of the most straightforward and most powerful prevention tools we have. It sounds basic, but consistency matters. Every preschool should have a clear illness policy, which include witness procedure, when children must stay home, fever guideline, congenital illness procedure, returning to school requirement, communication with families. If a child has a fever, vomiting, or a congenital condition, the proper priority is protecting the entire community. It is not about inconvenience nor community health, just pure, clean policy prevention confuse and conflict. Respond when a child becomes ill, even when prevention illness happen. When a child becomes ill during the day, they should be separated from the group. The staff member should notify the parents or guardian immediately. Symptoms should be documented. Clearing protocol should become prompt. Let's be honest. Sometimes parents feel pressure to send a child to school when they're not fully well. Sometimes programs feel pressure to make it work. Here is the truth. If one child gets sick and comes to school, several children may go home ill. Health safety requires courage. It is required consistency. It requires leadership. Prevention is easier than contentment. Health, hygiene, and illness prevention are not minor detail. They are part of the foundation of safety. A healthy community is a safer classroom. In our next episode, episode 4, we'll talk about emergency preparation for preschool and homeschool. Until then, stay aware, stay proactive, and remember, safety is everyone's responsibility. Thank you for listening to the HG Realistic Show with Mr. Grimm. If you find this episode helpful, please subscribe and support our show. If you have a question or topic you would like us to discuss, feel free to send them in and participate in the conversation. Our email is hgrealisticpodcast@gmail.com. Until next time, stay safe and take care.